Good evening and welcome to blackdoctor.org. My name is Shamika Rhymes and I'm so excited to be here tonight. And I'm so glad that you could join us tonight. Let me know in the chat where you are watching from. I already see some of y'all been anticipating this. So I see Asheville, I see Gastonia, I see Charlotte. Welcome, y'all. So tonight we're having a heart to heart, literally. We're talking about a condition called hypertrophic cardiomyopathy or HCM. It's often undiagnosed, it's misunderstood, and it hits our community very hard. So, as we kick off tonight's conversation, let's also remember that it's American Heart Month and it's a time to raise awareness about heart disease, which remains one of the leading causes of death in the United States, especially among the African American community. So, tonight we're going to be hearing from an amazing panel of guests tonight, which includes cardiologists, patient advocates, and community leaders. And we're going to be talking about heart health prevention and early detection. So let me introduce you to tonight's guests. First up, we've got Dr. Florian Rotter from Cedars-Sinai Smith Heart Institute in Los Angeles. He's a leading cardiologist specializing in HCM and advanced heart care. Welcome.
Thank you for having me, Shamika.
So glad you could join us. We've got Dr. Melissa Burrows. She's a cardiologist at Wellstar Health System, and she focuses on preventative cardiology and community heart health. Welcome.
Hi. Thank you for having me.
Thank you for joining us. And we've also got Lisa Salberg, founder and CEO of the HCMA, advocating for patients and families affected by HCM. Welcome, Lisa.
Thank you so much, Shamika. It's nice to be here with you.
I love the red. Both Melissa and Lisa wearing the red. Forgive me, I forgot to wear mine tonight. Yeah, it's okay. It's okay. Well, and our patient advocates are also joining us tonight. Devin and DJ Artist, they are father and son duo who are bringing that lived experience of managing HCM. And DJ actually has HCM, so we're going to hear their story as well. So let's kick this off tonight. Dr. Burrows, I'm going to start with you. Why is heart disease still one of the leading causes of death for Black men, and why is it often overlooked in our community?
That's a good question. When we talk about risk factors for heart disease, hypertension is especially common in African Americans and leads to a lot of the disproportionate outcomes, especially for heart failure and for stroke. And so, these are preventable diseases. And so in general, it is the disproportionate amount of hypertension. In fact, it's thought that hypertension is the leading risk factor causing for difference in life expectancy between African Americans and white Americans.
Thank you for that. And I think it's important, Dr. Rotter, to actually talk about what exactly is HCM and how is it different from more commonly discussed heart conditions like hypertension, high blood pressure, heart attacks, stroke, things like that.
Sure, yeah. So hypertrophic cardiomyopathy is a genetic disorder. There's a gene defect of one of the proteins that builds up the heart muscle. And from that genetic mutation that patients have, there's certain changes of the heart muscle, predominantly thickening. Hypertrophic means excessive growth of heart muscle. So you have heart muscle thickening, and that comes along with a lot of potential other problems and symptoms, which I'm sure we're going to get into in a little bit or during this hour. There's also a very interesting interplay between hypertension and hypertrophic cardiomyopathy. And I think one reason why there's underdiagnosis of HCM in general, but especially in our Black patients, because a lot of Black patients have hypertension. Hypertension leads to thickening of the heart muscle. So a lot of doctors will look at an echocardiogram, they see thickening of the heart muscle, and they just say, oh, it's from hypertension, and not considering that there could be a genetic problem going on. So that's a big part of this problem.
Thank you for sharing. And I want to, before I move on to the next question, I want to see if anyone else wanted to weigh in on that, or the other question about why heart disease is still one of the leading causes of death. Does anybody else want to weigh in on that one?
I do want to jump in a little bit. You mentioned in your question, why is it still the leading cause of death for men? It's the leading cause of death for women too. And women
Mhm.
tend to put themselves to the side when they're handling the health and welfare of their children and spouses. So I just want to remind women that you're in the game too. I was diagnosed with HCM when I was 12 years old, and women get it and men get it.
Thank you for sharing. Well, Lisa, since you're here, I'm going to ask you a question as well. Um, are Black men and women at a higher risk for HCM, or is it just simply like Dr. Rotter was saying, just underdiagnosed and misunderstood in our community?
So, of course, Dr. Rotter was correct that it's out there in everybody. But what do we know about HCM and sudden death in young Black athletes? This is a subset. We know through research done through the CDC Wonder database how many people die every year with HCM on their death certificate. We know through the great works of Dr. Barry Marin, the sudden death in athletes registry. So we know how many athletes die of cardiac causes every year. When you look at the athletes who are dying from HCM, 50% are African American males. And this is 24 and under. So we're losing more young Black males who are involved in competitive athletics, but that doesn't mean that they have more HCM than another demographic. There's HCM is 1 in 250 roughly worldwide. So that's not what's changing, but there does seem to be this risk that we don't fully understand yet. And the physicians can speak on this. We don't know why it is young Black athletes who die at a higher number than their Caucasian or Latino or Asian counterparts. So we know that's a problem, and we know we need to talk about it. And there's a young man here tonight who has lived the experience and thankfully is here to tell the tale.
Thank you, Lisa. I wanted to give the doctors a chance to respond to that before I get Devin and DJ to share their story.
I think it's important also to note that while hypertrophic cardiomyopathy is not more common in African Americans, the clinical presentation is often more severe with more heart failure, which is thought to be in part because of other comorbidities, things like hypertension and obesity that can increase your risk of heart failure in general, but specifically exacerbate presentations for HCM. And then, while genetic testing is often used in these forms of cardiomyopathies, African Americans are less likely to test gene positive. But when they do, it's the similar proteins that you see across the globe. So it's more a limitation of the science than a different disease.
Thank you. Dr. Rotter, did you want to weigh in as well?
Yeah, no, I agree with everything that was said. Genetically seen, I don't think there's an increase in HCM based on ethnicity, but there are different phenotypes potentially. And when we talk about young athletes, it's a little bit less clear, I think, why the phenotype is so different. When we talk about middle-aged or older patients, for sure, that interplay with hypertension and pressure overload and excessive hypertrophy compared to others definitely plays a role here.
Okay, thank you. And I think now would be a good time to hear from Devin and DJ. Can you just share your story and like what was it that you noticed in daily life, maybe that felt off, DJ and Devin? Did you notice anything? Was it kind of like, oh, you're just out of shape, or you're stressed, or you're just tired? Can you talk us through like exactly what happened before the diagnosis?
I would say just being able, like my sports routine, that's one thing that I realized that I was very involved in the sports, daily, going to track practice, football practice. Those are some things that like that's not really in my daily. Um, and yeah, it could be out of shape too, but
Well, let me piggyback on that. I think one of the main things of what we've seen now that I know, there were some, I wouldn't say symptoms, but there were some things that were abnormal. For him, for DJ, he was a all year athlete, track, wrestling, football. every season he was doing something. So he was he's in tip top shape. But there was some things that we noticed, like for example, like when he was at practice, sometimes he'll come back in the car and he'll say, "Hey, Dad, almost felt like I was, about to pass out."
Like a blackout kind of.
Yeah. He was like a black. I'm like, but I'm thinking like, okay, did you eat? Because he'll always get up in the morning and just go. So I'm like, man, you got to put some on your stomach. You got to, drink, hydrate. But so we brush it off. We brush it off. And then a couple months later, what would you say it happened again?
Yeah, it happened again. It happened at I think it was like 7-on-7 practice.
Yeah,
football practice.
Yeah, like football practice. And then that's when something in my brain was like, that's them normal. I mean, because for him, it's usually nothing for him to go. But when he says he's almost about to pass out, I started getting concerned, and that's when I, took that, I guess, took an importance to visiting the doctor, his PCP, which then referred us to a cardiologist, even though the PCP did claim that everything looked good from the outside. They didn't, of course, they didn't do an echo. So until we got to the cardiologist, that's when we really started to dig in and figure out, as far as what's going on. But in his situation, he didn't make it to that cardiologist appointment.
This would be a great segue to see what we have on the video.
Yeah, you're right.
A really good segue for that.
Yeah.
If you want to bring the video up to stage, I think it'll help tell this story in a pretty meaningful way. Are you ready?
Yes.
I'm Beverly Kidd, Larkspur neighborhood of Virginia Beach, where a dramatic rescue took place when a child collapsed during PE class here at Larkspur Middle School.
When we got to the hospital, they just showed the thickening of his heart. And then they told me that it was hypertrophic cardiomyopathy. He kept saying he was okay, but something was just off. Like it just felt like something wasn't right. That moments, I just felt like I had no control over anything. Without our faith, I think we probably would have just fell apart. This is not real. Like, it's no way my mind could not process the fact that he was just here, and now here I am getting things together for a funeral.
As soon as he came home from the hospital, what did he want to do? That's the first thing he said. Dad, when are we going fishing?
It's all personal. I've lost my grandfather, my great aunt, my uncle, my sister, and my dad to HCM. And it tried to get me too. I'm the lucky one, even with losing my best friend, my sister. You'll be able to see the full edited version on February 25th, which is HCM Awareness Day. You can register at the forhcm.org, our website, and you can see the entire video and how this story unfolds with family health history not coming to the forefront early enough to stop something terrible from happening to two different families. One was a resuscitation, thank goodness, and the other unfortunately passed away. But both families have DJs in them, so it gets a little confusing telling the story sometimes. Two families, two DJs, Norfolk, Virginia, and two cardiac arrests. One that had a happy ending and one that did not. So you can learn more about that on the 25th. But I thought that was a good way to tell like what happened.
Yeah, thank you so much for that, Lisa, because I was about to jump back to, well, what happened? But yes, thank you for sharing that. And thank you, DJ and Devin, for being so open to sharing your story, because I think it's very powerful and a testament. Gosh, I'm tearing up right now, but yes, thank you for sharing your story. Dr. Burrows, what are some of the early warning signs of heart disease that people often ignore or mistake for, oh, it's just stress, I'm just tired, or they just think it's something else?
Yeah, typically Any change in physical activity that you can't explain does deserve a cardiac workup, and it can be fatigue, which is tricky because people are fatigued for a lot of reasons that are not cardiac, but especially in someone who was previously active, didn't have any other issues, a sudden change in your ability to do activities that were easy to do in the past is a sign of heart disease. Passing out, dizziness, especially with physical activity, that is a concern. Chest pain and shortness of breath with physical activity is something that we often think about. And then palpitations, feeling that your heart is racing or beating irregularly can sometimes be overlooked. And it's hard because sometimes people say, well, it was my anxiety, but then sometimes people feel anxious because they have palpitations. So usually it deserves a full cardiac workup before we can say it's just stress or anxiety.
Okay, thank you. Lisa, I wanted to come back to you. You said you were diagnosed when you were 12. Can you share that story?
Oh, okay. My brain wasn't going there tonight. I was in a school physical. I was 12 years old. I was standing in the line with everybody else, had a physician listen to my heart. Now, I did have a knowledge that my grandfather had died young. He was 42. I knew my uncle had been diagnosed with some heart problems and my sister as well. So when they told me they detected a heart murmur, I said, okay, and went to the cardiologist and said, I got what they have, don't I? And he said, you understand genetics. And that was 1980. So it was a long time ago. My symptoms then could have easily been written off as athletically induced asthma because I got short of breath with exercise. And a lot of people said, well, maybe that's what it is. I had a lot of chest pain as a child. I passed out a few times. But when I was diagnosed in 1980, we didn't have the therapies that we have today. We didn't have implantable defibrillators to protect somebody from sudden cardiac arrest. We didn't even have AEDs out in the community. We barely had decent CPR at that point. So it was quite scary to be diagnosed in 1980 with a disease that at the time I was told I was 1 in 10,000, and it was that rare. We learned a lot more over the years, and I'm not that rare. We're in fact in a lot of places, and you'd be surprised to see where HCM shows up out there in the world and how many people actually have it. So DJ and I are joined by heart, pun intended. And I have about 22,000 other families that we've worked with over the past 30 years where they have big hearts too. And with proper management, they can live good, long lives. And mine took a turn. I ended up getting a heart transplant 9 years ago. But that was to be expected based on my family history. And I kind of saw it coming. So you don't have to be surprised. And yes, you can live a relatively normal life after a transplant, but only 5% of people with HCM will go there. There's actually an interesting educational piece that's just been launched by Sydney McLaughlin, the Olympic runner, and her dad. It's called On Track with HCM because her dad and uncle had HCM. So there's some really good content. And Dr. Burrows is the physician on that. I kind of forgot about that as I was talking about this great project. So you can see more of Dr. Burrows during that project as well. But it's really great, helpful tips on how to stay healthy. Despite having HCM, we can live very good lives.
Thank you for sharing. Thank you for sharing your story. Dr. Rotter, how does HCM increase the risk of sudden cardiac arrest, especially we've been talking about, especially during physical activity or sports?
Sure, yeah. So HCM, it's a bit of a difficult disease, and I love hearing from DJ and from Lisa how they got diagnosed, how they actually got to the doctor. I think it's so important because the symptoms are so non-specific that somebody connects the dots, that somebody thinks one step ahead and is not just happy with, little palpitations, it's just anxiety. Patients might just be out of shape, like you mentioned, but somebody connects the dots and just makes that referral to the cardiologist that actually gives you the diagnosis. So that's just a little bit side point. I also want to underscore here A little bit on the positive side, that sudden cardiac death, thankfully, is extremely rare. So just because you carry the diagnosis of HCM, it's not a death sentence. You don't have to be bummed out about it, but you just have to be cared for by somebody who is interested in the disease and knows how to treat the disease. And that way you can stay perfectly safe, live a almost normal life, I would say. And of course, there's some patients with more severe disease, and they may have symptoms for the rest of their lives, but the vast majority we can really treat now very, very well, and they have normal life expectancy and so forth. So it's important to underscore that, and although it's really important to think about the issue of sudden cardiac death, but we also have to see or acknowledge that it's less than 1% per year of HCM patients that will have that dramatic outcome. So thankfully, it's fairly rare. There's decent risk scores now that we can apply to kind of assess the risk of sudden cardiac death. And by no means these scores maybe not perfect, but they can put you in high, medium, or low risk groups for sudden cardiac death. And then you can get the appropriate management. And some patients just need some monitoring, easy sticker monitors throughout their life. We usually do it on an annual basis. If they're low risk, if they're higher risk, then yeah, they might need a defibrillator, but that's also, a device that keeps you safe and that can, is not really limiting your life in many ways. So it's really good treatment options now. Your question was why HCM increases the risk of sudden cardiac death. It's linked to a lot of abnormalities. One major abnormality is that from the thickening of the heart muscle, you can form some scar tissue in the heart muscle, which can perpetuate abnormal electrical signals inside the heart muscle, which can then lead to very fast heart rhythms that can be dangerous. So detecting these risk factors, we're becoming better and better at seeing these risk factors. Cardiac MRI has really helped us a lot understanding the disease a lot better and putting patients in the appropriate risk categories.
Thank you. And I guess this next question could be for you or Dr. Burrows or both, because one thing that I've heard a lot is that sometimes people are scared to go to the doctor. So if they get referred to the cardiologist, what testing or what can someone expect if they, this is their first time, they have no idea what's going on with their body? What can you walk us through a visit with testing and everything?
So the first thing we do is get a history and kind of get a sense of how the person's been feeling. I like to ask about, what were they like as a child? Were they restricted in PE? Were they restricted in doing sports? And then we also ask a family history. Did anyone in the family have heart disease? And I keep it broad because many people don't know the details about their family's heart disease. So we start with heart disease, and then we ask about heart failure, and then we ask about, HCM. But many people don't know the details. And we also ask about sudden death. Did anyone die unexpectedly without any reason, to also kind of look for signs. In terms of tests, we do an EKG. And the EKG can be helpful. It's a low-cost screening test that's very useful in the community. In a cardiology office, it's really just the first step because some people will have normal EKGs and have abnormal hearts. So we don't stop if the EKG is normal. And then we order other tests, including echoes, which is kind of the ultrasound of the heart. We have cardiac MRI, which Dr. Rotter referred to. And then we also have genetic testing, which is a blood test. So there's different levels of monitoring, additionally to heart rhythm monitoring as well. Then we have some more advanced tests that we sometimes do, stress tests, exercise tests, cardiopulmonary exercise tests, especially for people who are very symptomatic and very limited. And through our different testing, we can personalize and customize treatment. Not everyone with HCM needs all the treatments. Some people don't need any treatment. We're just being vigilant, making sure that we're looking for the early signs of heart failure and arrhythmias. Some of the abnormal heart rhythms can cause stroke, so we want to know about it before someone has a stroke and intervene, and then some can cause sudden death. So it's a level of kind of vigilance that you wouldn't typically get applied to every patient. But for those who are doing well and feeling well, they still need to come every year so that we can, make sure that they're safe and they can continue to do moderate physical activity without significant risk.
Thank you. I also want to remind the audience, or actually tell them because I forgot to tell them at the beginning. If you have any questions at all about HCM, please drop it in the chat. Okay. I want to go back to the genetic testing or family history. Lisa, you mentioned you were talking about that earlier. How does family history factor into heart health? And why is it, so important to know your history?
Probably would help if I took myself off mute. The perpetual problem of Zoom meetings and such. If I were to go back to the video that we showed you earlier, there's another family in that video, the other DJ, the other Derek. Derek had a family history of his mother passing away before the age of 30 on a heart list. But he was only 2 years old when mom passed away, so we lost some connection with the family history. When he collapsed and went to the emergency room and is told it was probably a seizure, go home, nobody ever asked him about his family history. It was the middle of COVID, so you got to give a little grace there, but nobody ever asked him about his family history. 6 days later, he died. He had a cardiac arrest and was not able to be resuscitated. So just knowing the trick of one's family heart health history, even if you don't know the actual name of the diagnosis, if mom died young, or if dad or grandpa was told no more football because there's something with your heart, this should trigger a conversation among the family. So knowing your family heart health history is so important, and Derek has moved my life in so many ways that we actually created an entire initiative called the All Hearts Collaborative. That it doesn't matter what the color of your skin is, we all share these genetic diseases that can be hiding in plain sight. So knowing your family heart health history is one of the first things that you can do to share that information with your chosen healthcare provider and say, hey, look, I have grandpa, aunt, uncle, cousin, sister, brother who this happened to. Could that impact me? We think of cancers as type of body and genetic connections. We don't think of heart disease in that same way, but we should. Knowing what family heart health history you have can help indicate what other tests may need to be done in that particular family. And when you have a family history of HCM, thick heart muscle disorder, think about talking to your doctor about what are the right tests for you and then for your family. Because if it's me, my daughter's also affected. My niece and nephew are also affected. My aunt and uncle, they were affected. So finding out all of the people in the family tree can help the doctors determine what tests should be done next and how we should manage you as a patient.
Thank you.
Maybe
Devin and DJ.
Yeah.
Oh, go ahead. I'm sorry.
Just one thought on that. I think family history is so important and sometimes a little bit confusing. Sometimes doctors just don't, again, think a little bit outside the box. I hear often, oh yeah, my uncle had a heart attack at 30. I'm like, 30? It's pretty rare that somebody has a coronary problem at the age of 30, right? But they died suddenly. They just had a heart attack. And doctors are just happy with that. And they say, oh, that's the reason we're not thinking about HCM. Drowning in somebody who is an avid swimmer. Sometimes people can crash their cars unprovoked and because they had a heart arrhythmia while they were driving. So it's important to kind of really ask for all these. Sometimes people don't think anything about it. They just think, oh, it was a motor vehicle accident or it was a drowning accident. Too bad. But then if you ask a little bit further and ask like, oh, that person was actually a really good swimmer, that could raise a flag, for example. So don't assume that what other doctors told you about your family is what really happened. Kind of question that a little bit.
I refer to those as family myths versus family truths. So if you're not sure if there's been a myth, dig into it a little bit more. Does anybody remember what actually happened? Was there a witness? Was there an autopsy? Is there a death certificate? And digging into that information, sometimes you come up with nothing but speculation, and that's a good conversation. But when you have some proof, father was told not to play football anymore. They told me my heart was a little thick, but I should be okay. These are triggers that people can use to determine who should be tested next.
Thank you. Devin and DJ, I was curious, did you guys know the family history, when you started to notice the symptoms, or did you even think about that at that point? Or was it just kind of like you got to kind of thought about it when you were at the appointment, like, well, wait a minute, so-and-so may have had this or this?
That's a good question. I think after the whole situation of as far as what happened, and as we started to learn in regard to this heart disease, my father didn't know. My father, he was a high school athlete, and he told me not too long after he had his situation that he had to stop playing football when he was in high school. I guess they did a little physical check or whatever that was done, and the doctor came back and said, you can't play some, I think it was a heart murmur or something along those lines, some heart condition. And he couldn't play sports anymore. And he didn't tell me about it. It was just something, the conversation that we just, ran across due to, from his situation there. So yeah, family history is definitely important. And even like till this day, we're, trying to figure out, what's going on with that. Like, what was that, specifically? But yes, that's family history is important.
Thank you. And I'm just going to throw this question out to anybody that can answer it. But say you know your family history, and there could be a potential chance that someone in the family had HCM or heart disease. Should someone still get screened or checked out even if they feel healthy?
Definitely. And that's a common referral that we'll have, not only for hypertrophic cardiomyopathy, but also for coronary disease and heart failure, because there can be, those diseases can also have some genetic underpinnings. And I think sometimes people feel like it's silly, I feel great. Why should I, see a doctor? But as, illustrated by DJ's case, sometimes the first presentation is very serious. And so you'd rather kind of have a diagnosis before it's symptomatic if your first sign or symptom is going to be cardiac arrest. And with hypertrophic cardiomyopathy, sometimes that is the case. Sometimes patients aren't identified until it's after a cardiac arrest. And we'd rather not do that. We'd rather know about it ahead of time, do the appropriate monitoring, and if necessary, do a primary prevention ICD defibrillator so that if they do have a fatal heart rhythm, they'll be shocked before you can even call 911.
Okay. This is for either of the doctors, but how can lifestyle changes, including, changing your nutrition, including exercise, be safely approached for someone that's diagnosed with heart disease or HCM?
Yeah, I can speak to that maybe. So I think lifestyle changes is super important. Everything that's healthy for your body is even more healthy for an HCM patient. So having a healthy weight, watching what you eat, staying very, very well hydrated all the time is absolutely essential in HCM. And it depends a little bit if you're obstructive or non-obstructive. In obstructive, it's even more important. And you will notice the difference on days when it's hot and you're dehydrated. The symptoms may be really a lot worse than when you're well hydrated and it's not as hot outside. Another thing to consider is that when we're going back, I don't know, maybe 30 years or so, the mantra was in HCM, you should be, really stopping any activity. And essentially, a lot of HCM patients were made by the doctors to be couch potatoes, which we learned through many studies and trials now that that's absolutely not necessary. In fact, activity and exercise is good for patients with HCM. They do better, they feel better, and in most activities, the risk of dangerous heart rhythms is not increased. Of course, you should have a plan with your physician. Your physician may want to watch you exercise. Your physician may want to do an exercise test to make sure there are no rhythm problems or other symptoms that show up during exercise. But I have triathletes, I have patients who absolutely insist I will not stop spinning with a defibrillator with very severe HCM. And, it's a shared decision making. They want to have the quality of life that they deserve. And me as a doctor, I want to support them in achieving everything they want in their life. So, but activity, lifestyle is absolutely crucial in HCM.
Thank you. And as far as nutrition goes, is there like reducing sodium, things like that? Would you say that would be kind of, I don't know if there's specific foods to avoid or anything like that?
Sodium is one of a high sodium diet will increase your risk of high blood pressure. And for people who do have heart failure, it'll cause fluid retention. So in general, everyone should, minimize their sodium intake unless they have very specific conditions that require that. But with HCM, any abnormal blood pressure or abnormal fluid retention will make the symptoms worse for many of the patients. So we do encourage them to monitor that. But to get back to what Dr. Rotter said, I've seen patients who were harmed by very strict physical activity restrictions. For many people, it caused depression, so mental health problems, but then also their physical health sometimes deteriorated. They gain weight, get diabetes, sleep apnea. So I like to tell my patients, the goal is not to preserve your heart in a little box and watch the rest of your body deteriorate, which can happen to people. We want to look at you as a whole person and make sure your whole body is healthy. And make sure that we give recommendations that are appropriate for your risk. And if you are a low risk person, we don't need to be so restrictive.
We even have professional athletes today with diagnosed and well-managed HCM. It doesn't mean because you're diagnosed that you're going to be benched. In 1980, when I was diagnosed, no more softball, no more gymnastics, just sit down. That was not the healthiest thing for me. But at the time, I give credit where credit is due. In 1980, I'll bring back some names from 1990 even, Hank Gathers, Reggie Lewis. So if you watch the video of Hank when he passed away, there was no AED, there was no emergency response plan, there was nobody ready to deal with his emergency. The poor man lay on the floor and die in front of everybody. From 1990 to 2023, when we saw what happened to Damar Hamlin during the football game on a Monday Night Football, he goes down commotio cordis, not HCM, but the emergency response time. That was 30 years of science and talking and trying to change the world, and he came right back. So no, he was not HCM. I don't want to confuse that. But if somebody does go down on the athletic field today, we have a much higher chance of saving them with good emergency response planning. We know who the patients are. We can be careful and prepare for an event. And if they're a diagnosed patient with high enough risk, they may get an implantable defibrillator. But we don't put in defibrillators so that you can play sports. It doesn't work that way. The doctors can comment on that. But the important message is you can be active. I even got a phone call this week, the docs don't know this one yet, from a 75-year-old man who is about to set a Guinness World Record for marathon running, and he was diagnosed 2 years ago with HCM. And he's been running marathons his entire life. Would we tell somebody with HCM to go out and run marathons today? Not so fast. The doctors want to have a talk with you first. But there are people who have survived it and can do it. So I don't want people to be afraid of diagnosis because it may limit what they're able to do competitively and sports-wise, because we can do so much to help improve your quality of life and save your life and give you more time to live if we get you diagnosed early enough.
Thank you for sharing that, Lisa. DJ, I know I'm going to put you on the spot one more time, but what advice would you give to other young people who might be experiencing, some symptoms? They're not quite sure what's happening, but they're a little hesitant to tell their parents.
my advice would be, just go talk to your parents, go talk to your family, like grandma, grandpa, go talk to them because a lot of time it's really in the family, and that's what happened to me. So I will go talk to your family, check up, tell your parents to schedule an appointment for the doctor, a cardiologist, someone that can identify why you're having those type of symptoms or why you're, acting that way. Um, because that can really change a lot, especially your quality of life, because you never know what you really have.
Mhm. Well, that brings me to my next question, and this is both for Devin and DJ. What was the hardest part emotionally or mentally about getting the diagnosis, and how did your family cope with it? And did you, what did you rely on to help you get through this, and besides the doctors?
God. To be completely honest, God and family, and honestly the main support from the organization, like with Lisa, because I didn't know nothing about it. I didn't know it existed. I had no idea. I mean, this kid, he's 12 years old, you know. Um,
Mhm.
so I would say a lot of family support, a lot of close friendships, professional advice, like through the organization, ACMA organization. Um, and you got to realize, I truly think that I'm still dealing with it. I don't really think that I've got it all together.
Mhm.
It's more like I take a day at a time. Take a day at a time. And DJ knows that we talk about it, and it's hard conversations we have. PE, sports. He still wants to play sports. There's little things that but we just have to look at it different. We have to look at it. There's certain risks. There's risk levels to activities that he does. So I think he's growing into it. Understanding what it is and realizing that it's not a death sentence. Like you said before, it's more how you manage it, and you can live a normal life. It's just different, and different is not a bad thing. Um, but it's hard. I'm not gonna lie. I just can't sit here and say it is hard as a parent to want to see your kids do whatever they want to do. It's hard.
Mhm. Thank you for sharing and being vulnerable
Mhm.
with that. I do see we have a question in the chat. Doreen Pinkney says she was diagnosed with HCM. And she said her doctor suggested she do genetic testing. She's asking if genetic testing will give her more clarity as to whether or not, there could be, and I don't know if there is an opportunity here like for misdiagnosis, or if it would provide more clarity. Could one of the doctors speak to that question? I don't know if I need to rephrase it a little bit better.
No, that's a good question.
Okay.
And it's complicated because this is one of the diseases where you can still have the disease and not test positive. So it doesn't always give you a clear answer. But what it
Mhm.
can do is exclude other diseases that can mimic HCM. And I've had some of those cases where there was a different treatment and we would have never known had we not done the genetic test, because by cardiac MRI and echo, it all looked like HCM. I've had that happen a number of times. And it's helpful also for the family screening. If you have children or siblings or parents, if you do test positive, they can be tested as well. But there are times where, as we mentioned, the genetics are complicated. There are a lot of variants that can cause HCM, and we're still learning. So sometimes there's an indeterminate result, meaning we can't say that that variant is disease causing or not. And that may change over time as variants get classified and reclassified. So, and it also depends on, in my experience being in the South, what is reported in the literature as the percent of patients who test positive, who have a confirmed diagnosed HCM, is much less in this region. And that's across all ethnicities. We have a very diverse population here in Georgia. So, and we just say, just because it's negative doesn't mean you don't have the disease. But it's helpful. And I think it's leveraging the science, leveraging the technology. This was one of the, first cardiovascular diseases to have a genetic test available. So, and for many folks, it is helpful.
I will just add one piece to that. We are conducting something called an externally led patient-focused drug development meeting with the FDA coming up in April. If you wander over to 4hcm.org, we will be posting shortly a questionnaire for those with HCM, known genetics or otherwise, to see what the burden of disease is and what kind of therapies you might want in the future. There is a current clinical trial with a gene therapy for one of the gene mutations that hits HCM, myosin binding protein C3. 6 patients have been dosed so far. It's looking promising, but it's very, very early days. And we actually need to hear from the entire community affected by HCM. What do they want out of a genetic therapy or an RNA-based therapy or something beyond a pill? Is there anything else you're willing to do, things that you want the FDA to know about that are important to you as decision makers in these therapies? So they can pop on over, and that'll be on the website probably tomorrow.
Can you get the website one more time?
The number 4hcm.org.
Okay. I was wondering if it was 4 or FOR. Thank you.
It's a long story that has to do with the Hispanic Christian missionaries stealing HCM as a website.
Okay. Well, as we wrap up, I want to give everybody a chance to respond to this question. What is one step that individuals and their families can take this week to better protect their heart health and start the conversation about HCM? Dr. Rotter, I will start with you.
Yeah. So I think one important thing being within a family is just to talk about health. In a lot of families, I hear that many times is that people don't really share their health problems. Brothers, sisters don't want to talk about their heart conditions, their blood pressure, and so forth. And just to open that communication can oftentimes, I think, give you important hints to maybe things you should look out for in your own life. If you learn that your uncle had a heart attack at 35 and maybe it was a true coronary event, then maybe you want to look a little bit closer at your cholesterol, your blood pressure, and so forth to prevent problems down the road. So I think open up communication about health.
I think that's
Thank you,
what
Dr.
I've been.
Burrows.
Yeah, that's the family history and the family conversation is really important. I think similarly to pay close attention to your diet. In general, beyond HCM, a lot of people have diseases that are directly related to the diet. And as I mentioned before, the other diseases that are more common will make HCM often worse: uncontrolled high blood pressure, obesity, diabetes. And there are plenty of my patients where I'm more worried about their diabetes at this point than their HCM, because that's what's more likely to cause harm. Minimizing processed food, minimizing fast food, minimizing convenience foods. And I think that's particularly challenging in the United States. I've lived in South America for a year, and it was just easier and more of the default to eat less processed food. That just wasn't a part of their culture. Even in a very nice grocery store, they didn't have as much packaged food because people don't buy it. Here, it just became normal for so long, people can't imagine a world without processed food. But I really think everyone needs to take some time and get off of it. It is really harming everyone, not just from heart disease, but also for cancer risk.
Amen. I could not agree more.
Lisa, I was coming to you.
Yeah, I was going to say, I'll add something a little bit different. We haven't really talked about this. When you have HCM, you might not recognize what you're feeling as a cardiac symptom. So what DJ talked about earlier, that he almost passed out a couple times or he felt like he was going to pass out. those near syncopal, near passing out experiences should be reported to your doctor. And if you feel like I'm just not keeping up with my peers, and I don't care if it's a 12-year-old peer or a 50-year-old peer, if you're the one in the back of the line when you're walking someplace, if you've eaten a large meal and find yourself really short of breath and unable to walk, this isn't normal. When you have HCM, you think it's normal and you think you're fine, and this is just the way life is. It's not normal. And most patients with HCM don't recognize symptoms until they become moderate to severe. They don't recognize those minimal symptoms that might go from minimal to moderate. Talk to your doctor. If you think you're feeling something, take notes. On this day, I felt this after this event. And see if you can find a pattern and discuss it with your healthcare professionals to identify the appropriate next steps for you. That would be my one thing.
Thank you. And I want to, before I move on, Lisa, do you want to mention again about the video we saw earlier where people can see it on February 25th?
Yes. You know what I can even do? I think, I don't know how to drop links in your piece here, but I am going to go grab a link to the actual event where people can register and watch the entire video and see some of the work that we're doing. I'm going to drop it down here. It's
Okay.
really long. I'm sorry. But that's going to the panelists, and maybe Aja could help share that with the rest of the community. So you just go to the 4hcm.org website, and then there's an events registry, and you'll see the event on February 25th, which is HCM Awareness Day. We have 19 states that have HCM Awareness Day in perpetuity. We have another about 15 states that have signed proclamations this year to recognize HCM Awareness Day, which is always the last Wednesday of Heart Month. So you can come see the video with us then. If you happen to be in the New Jersey area and you want to come by, we're doing an open house, so you can sign up for that as well. And you can come see what we do here at the HCMA every day. And you can even see our plastinized heart collection, where my heart is sitting in a box over there. I use her as a teaching tool, but that's a whole other story for another day.
Oh,
I got
wow. I'm
Shamika the
curious
tenth
about
on
that
that one.
story. So you got to come back.
I'll come back any old time.
Yes, I want to know more about
Absolutely.
Devin and DJ, what's one step or advice that you would give individuals and their families? One thing they can do this week to better protect their heart health and start the conversation on HCM.
I gotta think about it.
Yeah, okay, you gotta think about it.
Okay.
One thing that comes to my mind is just communication. I feel like a lot of things in life we if we don't communicate effectively, then we go this way or go this way. It may not be interpreted the right way or whatever, but I think it's very key, especially when it comes down to your health. And as I'm getting older, I'm not old yet, but as I'm getting older, I'm starting to realize that we gotta not be so afraid to talk about things with each other, whether it's your friends or family. So I would say communication, just being more open with your lifestyle and all that good stuff. What'd you say?
Yeah, follow up. Yeah, talking to relatives, because that's a very big part, in deciding what you have in your symptoms and stuff like that.
I like that.
Thank you.
Mm-hmm.
Yeah, that was a good one, DJ. Well, I want to thank you all for coming tonight and sharing some personal stories, and the doctors sharing their expertise. Lisa, you got to come back and share this heart story, because I want to know more about it.
It's an interesting story. Happy to come back.
It is. And you all gave some amazing advice today. For more information about heart health, you can head over to blackdoctor.org. There's articles and resources over there. Again, thank you all so much for joining us tonight, and thank you all in the chat for watching. Have a great night.
Thank you, everybody. Happy Heart